Hi, guys. Welcome back to another episode of the Chronic Chronicles. I'm your host, Lexy Halloran, and today we are joined by Karina, who is here to share her experience with endometriosis, from the early signs and the struggles to navigating the healthcare system and then also finding ways to manage her symptoms. Karina's story is one of resilience and strength, and I'm so excited to get into it. To get us started, do you want to go ahead and introduce yourself?
Yeah, so I'm Karina Del Toro. I am a nurse currently working on a postpartum unit in Tampa, Florida. And I'm also in school to become a women's health nurse practitioner. And
Ooh.
I also happen to have endometriosis and a bunch of other women's health conditions. So I really feel like I have an interesting perspective as both the patient side and the provider side of stuff.
Yeah, that's awesome. Congratulations on going back to school. That's exciting. So, which one came first? Like, did you get diagnosed with endo before you became a nurse, or did you become a nurse because of endo? Are they correlated?
It's kind of all merged together, sort of. So I'll hop into
Okay.
I I knew I wanted to go into the medical field and nursing for a really long time. So I was already planning to go to school for that. And
Mhm.
before going to college and nursing school, I had been dealing with a grocery list of period
Right.
problems. Basically, any period problem under the sun, I've probably experienced it. So I already had a lot of experience interacting with healthcare. So I really knew I wanted to go into that. As I was in nursing school, it was near the end of my time in nursing school that I started to experience my endometriosis symptoms, diagnosed a couple years into being a nurse. But I feel like my experience with endometriosis and women's health in general did kind of guide me towards becoming a women's health nurse practitioner because I knew I
Right.
wanted to go to school, but I didn't know exactly what area.
Yeah, that makes a lot of sense. So, right now, you're working on you said postpartum unit? Okay. How long have you been doing that?
I've been there for, I want to say almost like 2.5 years on post.
Okay.
Yeah, I really like it. It's nice to work with like moms and babies and
Mm-hmm.
a little blend of, your typical hospital care, but also getting some women's health in there. So I like it.
Yeah, I really like that. I feel like that is, um, you and I will have to talk like outside of this. That's awesome. So, okay. So what were some symptoms that you were experiencing with endo? Like what were your top symptoms?
So my biggest things were severely painful periods. That was one of my,
Octavia was founded by someone who knows the challenges of living with endo firsthand. They've created all natural products specifically designed to help manage endometriosis symptoms, and their standout is the Ease Please suppositories. These tiny but mighty vaginal suppositories are packed with 150 milligrams of broad spectrum CBD, which are designed to target pelvic pain right at the source. And these help reduce inflammation, relax muscle tension, and improve circulation without all of those fragrances and fillers and harsh chemicals. Octavia's commitment to clean, plant based ingredients means you're getting a product that is both powerful and gentle, and it's crafted with the needs of endo warriors in mind. If you're interested in giving them a try, you can head over to heyoctavia.com and use code Chronicles for a discount. It's time to give your body the support it deserves.
like, I can remember the first period that I had that I was like, oh my God, like what is happening? This is not
Yeah.
because I would have a lot of cramping, a lot of back pain, and it would get to the point where the pain, like even with pain medication, makes me like vomit, like throwing
Oh.
up, feeling like I'm gonna pass out from pain. I also dealt with a lot of pelvic floor related issues, so a lot of like muscle spasms,
Hmm.
pains. I know a lot of people make jokes about like feeling like you're getting stabbed in the butt, like on
Yeah.
yeah, like you're sitting on a knife. That would happen really bad. I would have a lot of pain with like intimacy, just
Hmm.
anything with the pelvic floor. And eventually that just became like chronic pelvic pain. And slowly it kind of evolved from just being pain on my periods to pain on my periods and during ovulation. And then
Mm-hmm.
eventually pain like every day, not necessarily cramping, but some sort of pelvic pain related symptom every single day. And then at that point, I was like, this is definitely not normal. And I went down the rabbit hole of figuring out what is wrong.
Yeah, that makes a lot of sense. All those symptoms are definitely, yeah, endo red flags. So how did your diagnosis process go?
So, being there, I'm like a huge nerd. So, I
Hmm.
unfortunately had already had a couple negative experiences trying to get diagnosed.
Hmm.
I had gone to my general physician and explained all my symptoms and was basically told, "Oh, well, some people just have painful periods, so
Hmm.
there's nothing wrong. Like it's just something some people have." And I left that appointment. I was like, "Oh my god!" I was crying because I was so frustrated because I just knew it's
Yeah.
not normal. So I waited a couple months. I did a lot of my own research and basically came to the conclusion myself that I think I have endometriosis. So
Yeah.
I found a new doctor to go to. It was a midwife, actually. So I went to the midwife. I explained all my symptoms to her, but I didn't tell her that I thought I had endo because I wanted to hear what she had to say.
Yeah.
And this part, it really like sunk in for me because she looked at me after and said, "You look like you could be on a commercial for endometriosis. Like you have textbook endo."
Yeah.
So it was really a validating moment, but it was sad also because I feel like this is something a lot of people with endo can relate to is
Hmm.
wanting diagnosis so bad, but also when you get it, it's kind of devastating because it's a lifelong thing.
Hmm.
So I knew that the gold standard was a laparoscopy and excision, so I wanted to move forward with that. Um, and I asked her to refer me to a specialist, and she was kind of hesitant at first, just wanting to put me on birth control instead. But I just
Hmm.
was pretty adamant that no, I wanted to get the laparoscopy. So went to the specialist, was basically told him the same thing. He said, "Yeah, sounds like endo." And we did the surgery in November 2022, and then they diagnosed me with stage 2 endo.
Okay. So you did the excision for your surgery then?
Yeah.
Yeah, that's nice. Um, Unfortunately, I like back in 2018 when I had surgery to get diagnosed, they did the ablation and I didn't really know that there was an Hi, Bella. Oh my gosh, my cat just came in here and she's like screaming at me. Okay. Um, oh yeah, so they did an ablation and I didn't really know that there was an excision. Also, like I didn't know that much about endometriosis either, so I was just kind of like, okay, that's fine. And I feel like I mean, I don't know this, but I feel like it might have done more harm.
Yeah.
Yeah, because my doctor told me that I would have like relief from symptoms for like a year or two, and my symptoms came back in like 3 months.
Yeah.
So,
It's so frustrating. I feel like with endo, especially, you literally have to be your own doctor because
yeah, I know.
misinformation about it, even just in like the medical field, it's so frustrating.
I know it gets really frustrating. So, how does that feel as like a medical provider, like as a nurse? And now, going into you will be a nurse practitioner, I'm assuming
Yeah,
in women's health for people with PCOS endo, like how do you feel about that?
it frustrates me to no end. I like this is something I'm so passionate about, not just endo, but women's health in general. But
Hmm.
the amount of misinformation, and I just feel like general. I don't want to say like laziness because I don't want to come across as judgmental, but
Hmm.
kind of just like complacency with accepting the state of women's health.
Yeah.
So frustrating to me. I know there's a lot of factors that go into it, so I'm definitely not putting blame entirely on providers. It's not doctors' fault. It's not nurse practitioners' fault. It's like a bigger issue, but
Yeah. I mean,
yeah, I feel like it's just a general acceptance of mediocre health. And
mhm.
I don't know. When I'm a nurse practitioner, I really, really would like to help women get to a state where they're not just surviving with their health, but where they're thriving. They're
Yeah.
feeling their symptoms are actually being healed from the root and not just we're putting a band-aid of birth control on every single symptom you have.
Yeah. I I think that's super important too. And I know I feel like I say this on the podcast pretty frequently that like sometimes I do come across sometimes like I am bashing medical providers, and like that's not what I'm trying to do. Like I believe in medicine.
Mhm.
There's a big part of me that like still wants to be a medical provider, and I'm like trying to figure out what I want to do with that. It's not even like it's not their fault. I've worked in healthcare. I get it. Like they're overworked, they're tired. They
Mhm.
only like medical students, it's not like they get lectures about endometriosis. And if
Yeah,
they do, it's one. Like
yeah,
they
that's
don't
part of the
get,
truth.
that's
Yeah.
part of the problem. And
Mhm.
then outside of that, like it's our healthcare system in general and like the research that goes into women's health. There's not funding for it. And it's just, there's a whole
Yeah. It's
battery of
very,
issues.
very nuanced conversation, I feel like. And I feel
Hmm.
like it's easy for people to appear like you're, black and white, but it's a very gray area. And I've learned a lot about that, being someone that is in healthcare, but also someone who I'm really passionate about, like holistic health. That's what I
Yeah.
really kind of blend is women's health holistically. But it's hard because on one side there's, the holistic health community that's anti-medication,
Hmm.
anti everything, and your doctor just wants to make you sick. And then on the conventional healthcare side, there are sometimes doctors that are just nope, holistic doesn't work at all.
Hmm.
There's no middle ground. So it's
Hmm.
find that, but it's definitely interesting to learn about. And it's something I'm learning every day, I think. The more that I
Yeah.
go through this experience of having endo, the more I can see both sides and I feel like find a good middle.
Yeah. That makes a lot of sense. I don't know. I feel the same way, like especially as I get older, I feel like for a long time I was kind of against holistic health. Um, Only because I didn't understand it. Like it was I thought it was very hippy dippy. It was like, oh, it's not gonna do anything. Like that doesn't matter. I also like didn't think that my diet, like it would piss me off when my doctor would be like, cut out dairy, cut out sugar, cut out gluten, you'll feel better. And I'd be like, what does my diet have anything to do with my chronic period symptoms? And
Yeah.
now I know that it's like more than my period symptoms. But like, speaking of diet and managing endometriosis symptoms, I want to share something that has been really interesting to add into my diet recently. Muji colostrum. Managing endometriosis often means paying close attention to diet and gut health, and that's where Muji can really make a difference. It's not just another supplement, it's a comprehensive, all natural colostrum designed to support your body from within. Each serving is packed with bioactive nutrients like immunoglobulins, growth factors, vitamins, minerals, and prebiotics that are all working together to support your gut health, boost immunity, aid recovery, and promote overall wellness from within. And what's special about Muji is that it has really good absorption. So they've chosen ingredients with high bioavailability to make sure that your body can easily absorb and use these nutrients, which is really critical for anyone managing chronic conditions. If you're looking to support your health through diet and other supplements, you can give Muji a try. You can visit Get Muji, that's Get MOOGI.com, and use code Chronic Chronicles for a discount. When I was 19 and I got diagnosed, I didn't understand it. I'm like, this doesn't make sense that, like when I would have anxiety because I was in so much pain and I was going to fail my classes and I had my therapist telling me to do deep breathing. I'm like, what the fuck is breathing going to do for me? Like,
I
this is
know. I know.
annoying. I'm like, you're annoying me. Like, you're not giving me like real. And she was
Yeah.
like, it will help if you give it a chance. And I'm
Yeah.
like, I no, like I'm not, deep
Yeah.
breathing does nothing for me. And I think that that all is also like a mindset thing. It's hard to, if people don't want to hear things, it's not gonna help them.
Yeah.
So it's kind of like you have to be in the mindset to there was a long period in my life where I feel like I was just kind of in denial about having, like I knew that I had endo. I
Mhm.
told people I had endo. I would have endo flare-ups and I'd be like, oh, my endometriosis, but I just like wasn't in the mindset to do anything to like really help myself. And I will, the gynecologist that I had, like, this is when people are like, oh, she's bashing healthcare. And like, it was just one bad doctor. Like, I've had good doctors since then, but um, I don't think that it helped either, that I just like wasn't really like, I was just overwhelmed and I
Yeah.
wasn't in the mindset. So I don't know. What kind of treatments have you tried for your?
So honestly, everything. So conventionally, I've done, I didn't take birth control for endometriosis, but I was on it before I started my endo symptoms for like
Hmm.
things. It didn't mesh well with my body, so I don't take any hormonal like medications now.
Yeah.
I got the excision surgery, obviously, like we talked about, but unfortunately, I never really got any pain relief from it. So that has led me down a bunch of different trial and error sort of things. And we just actually did an MRI and found more endometriosis. So I'm going to be having another laparoscopy and excision in August.
Wow. How
Uh,
does I know that it can show up on imaging, but for a lot of people it doesn't. Were you able to like you personally, did you see it?
yeah. So I was surprised because because I knew it doesn't normally show up. So
Yeah.
I was shocked that anything did show up. They could see it on my right, like uterosacral ligament, and then actually on
Oh,
this as well. So
interesting.
yeah, very interesting
I'm wondering if, again,
because
this is just clearly like a thought. I have no idea. No idea at all. So anyone who's listening, do not, literally just a thought. But I'm wondering if now that like people are learning more about endometriosis, and I will, like, in the last 3 to 5 years, it has been talked about a lot more. I'm wondering if maybe it's not that you can't see it on imaging, but people weren't trained to look
it could
for
be,
it.
it
So
could be
I'm
yeah,
like,
because when they did mine, it specifically said like MRI for endometriosis. So
yeah, I'm wondering if people are, yeah, just getting like more training on what to actually look for
yeah,
that might be endo.
yeah.
Whereas before, like, maybe they just didn't know what to look for. So they were like, oh, this like looks
It,
clear.
even though they're pointing it out, it is very subtle. Like when I'm looking
Yeah.
at it, I guess I can see it, but yeah.
Yeah, because it is a lot. I don't know if you've ever looked at like endo adhesions and lesions like imaging during surgery. It's a lot easy. Like I can see them. It's a
Yeah,
lot easier to see, not
yeah,
all of it. Like obviously you
yeah,
should still be trained for that, but it's a lot easier to point out like black lesions and like adhesion like bands and when you're actually doing surgery. So I understand how it could be missed on imaging, but I'm like, I wonder if people maybe just are getting more trained on how to look for it.
and then I guess going back to the treatments, like more
Hmm.
holistic kind of things I've tried, pelvic floor physical therapy has been like my lifesaver. I've been going for years now, and I will never stop because it is the thing that really gives me relief and helps me be like more functional. So I can't recommend that enough. I've tried a host of different like dietary changes, anti-inflammatory diet. Um,
Hmm.
I've tried to kind of clean up my personal care products to remove like what they
Hmm.
call, estrogen, like exposure,
Hmm.
um, as well as like castor oil packs, stress reduction, herbalism, like a bunch of different. Unfortunately, none of them have really given me the relief I'm looking for. So that was a hard pill for me to swallow, especially as someone who would prefer to avoid surgery.
Yeah.
But I think I'm learning like sometimes the conventional way is the answer in some cases. And not to say the whole
Hmm.
thing doesn't work. I think that I would 100% be worse off if I didn't do all the lifestyle changes that I do. I think it helps
Yeah.
me functionality and quality of life, but sometimes you do have to do that, conventional side. Oh, I also did a series of like pelvic muscle and nerve injections with a pelvic pain specialist.
Oh, okay.
Very painful, but
Yeah.
it didn't give me a ton of relief. But she was the one that thought, okay, maybe you have more endometriosis now because this
Yeah.
really works and it's not working for you.
Yeah. Wow. Okay. So I've never heard of the
But
injections. I've never heard of the injections before, but that sounds interesting. I've done, I think all of that outside of straight up herbs. But I mean, I'm doing seed cycling now, so I feel like that is kind of
Mhm.
doing that. Yeah, I feel like it's just different for everyone, right? Like it depends where your endo is, how much of it you have, how bad your symptoms are, what symptoms you have, like which ones are you trying to combat. For me, I still get really, really bad cramping, and I went from probably like 10 days a month of getting them to like now I have probably 4 to 7 days, which is good.
Yeah.
But it's weird too because like I don't know, have you had like pretty regular cycles or do you have
I used to not. I used to
Mhm.
be so all over the place, like
Yeah.
all over the place, but I've regulated them now with like different lifestyle changes. So now that
Yeah. Yeah, it's difficult. So I've been on an IUD, well, like multiple IUDs since I was 16, so for 10 years. And I don't know, like thankfully, one of my biggest symptoms when I was in high school was that I would bleed through like literally everything. And it's that was like my I, like primary symptom. After that, it was cramping, and the cramping was really bad, but like the bleeding would keep me from school because like I would bleed through everything and I was like I have to go home.
I've had
So
that before. Yeah.
yeah, so that was like my number one thing that I needed to figure out first. So the IUDs have helped with that. I don't think they've helped with literally anything else. Like I still get period symptoms every like I get everything that comes with a period outside of like actually bleeding.
Yeah.
Um but the downside of that is that I have no idea really when my period is because I don't get like 10 days of cramping. I get like 4 to 7, but they're not in a row, which makes it really confusing. So I'm like, I don't think that I have regular periods based
Yeah.
off of that.
Yeah. I
But
sometimes I mean, I don't know for sure. I don't know which one you have or anything, but I
mhm,
think sometimes like side effects of the IUDs can be cramping. So it's
yeah, it
hard.
just
It's
gets
so hard
really,
to tell. Like, is it endo? Is it the IUD?
hmm
Like it
it
gets
gets really confusing. And then because I have like all of the period symptoms, but I don't have them. And I've been like trying, it's so hard to track that when you're not bleeding because you're like, okay, well, I don't actually know. Like, are
yeah.
my boobs sore because of that or are they sore from something else? Like,
Yeah.
I don't know. And then I don't like realize that I'm moody until after the fact. And then I'm like, oh, I guess I could have tracked that, but like I didn't know. It's so confusing. And then I feel like my cramps have like no rhyme or rhythm. So I'm like, trying to get that all under control.
Frustrating.
It's so confusing. So, God, I feel like I had a point with that, and now I don't know what it was. Other than telling you about my period, I guess. Um, what's the point with that?
What were we talking about?
I don't know. Oh no. Um,
It's fine.
okay. We were talking about treatments that you did.
Yes.
Oh, I wanted to ask you more about like, do you do any holistic things in tandem with the conventional. So you're still doing pelvic floor physical therapy right now. Is there anything that you do like before or after that? I was going to ask you that because I did pelvic floor physical therapy and it's different for everybody, but for me, like it would induce cramps pretty bad after. And I don't know, I only did it for probably 6 months and then I
Yeah.
stopped
Yeah.
because I was like, okay, I don't think this is helping. I just keep getting cramps. But is there anything that you kind of do to like prepare yourself for that?
Usually, I really love my physical therapist. She's like
Hmm.
fantastic. Usually, what we'll do is during the session will be kind of a mixture of like some stretching, some strengthening exercises, and then a lot of manual therapy. So she'll
Yeah.
work not just on my pelvic floor, it'll be more like almost full body. Like she'll do my back, glutes, hips, legs a little bit, and then the pelvic floor work, like internal and external.
Mhm.
And Yeah, it definitely can be painful.
Yeah.
Sessions, but I'll try usually to stretch beforehand, and then afterwards, I sometimes will have pain afterwards. I don't get cramping, but I do get like very sore. Like my pelvic floor will just hurt because the way she explains it to me is those muscles sometimes are so like clenched
Yeah.
that once you get them to let go, you're going to feel a lot more pain because you're getting more nerve flow, more blood flow. All those
Mm-hmm.
things should have been there but weren't there because the muscle was basically like strangulating it.
Mm-hmm.
So it is more uncomfortable.
I talk about some days all of the time, whether you follow me on Instagram or you just listen to the podcast. I know that some days has been something that I've talked about a lot in the past, what is this, like 9 months that I've been doing this podcast. And I talk about it so much because I truly, truly believe in the product and I believe in the mission of the company. Some Days is here to ease the pain of period cramps and other symptoms with their all natural plant based products. And they're founded by someone who truly understands the struggle. They were founded by somebody with endometriosis. Some Days is dedicated to creating products that support your body naturally, and one of my favorites is their cramp cream. I have cramp cream in both of my bathrooms, my bed stand or my nightstand next to my bed, and in my car. I have Some Days cramp cream literally at an arm's reach at all times of the day. And it's like a soothing hug for your abdomen during those really rough cramps. It's made with all natural ingredients, so you can feel good about what you're putting on your skin. And it's not just about the products. Some Days is about supporting you through your ups and your downs of your chronic condition with clean, effective solutions that are gentle on your body, but really, really tough on pain. If you want to try out any of their products, you can visit somedays.com and use code Chronic Chronicles to get a discount.
So it's definitely like a mental game to push through that and keep going. But
Yeah.
I I do have a couple things that I'll do. So sometimes I'll do like warm baths, helps with the soreness. Some more gentle stretching or like
Mm-hmm.
muscles with like a tennis ball. If I'm feeling
Okay. Yeah.
arnica, I don't know if you ever heard of arnica. It's like
No.
on topically that helps with like muscle aches. So sometimes I'll put that on, or I do have the suppositories that were given me by the pelvic pain specialist. That's arnica and CBD together.
Hmm.
That helps with just like inflammation. So sometimes I'll use those to kind of help that. Um, and then doing exercises at home also helps because I think it's more painful, I notice, if I don't do any of my exercises at home. And then when I go to her, I'm like locked up.
Yeah.
Work through all that. Whereas if I work at home consistently, it's not so bad and not so extreme when I go. So I have something, I don't know if you've ever heard of it. It's called a pelvic wand. It's
Yeah.
basically, yeah, like a little tool that you can use to reach the pelvic floor muscles internally on your own. So I'll do that. Not as often as I should, but
Yeah.
sometimes.
Another follow-up question with pelvic floor physical therapy. So you obviously don't have to answer this, but how do you like compartmentalize that
Mhm.
and then still have like a healthy, intimate life outside of that?
Question.
Because
It's
I
a good
know that for a lot of people that can be really
uncomfortable.
difficult. Yeah. And kind of um yeah, I know for me when I did pelvic floor physical therapy, I just like I was like I have no like my sex drive was gone.
Yeah, it is hard. I think being medical maybe helps me a little bit because
Hmm.
when I'm at work, for example, I've seen so many like human bodies at this point. Like it doesn't
Yeah.
need to have, like, pants on or whatever. So like
Yeah.
going to do physical therapy like that, it doesn't, I don't think, bother me as much as maybe other people, but
Hmm.
it's still hard. I mean, not just with physical therapy, but with endo itself.
Yeah.
Intimacy is difficult. Like that has probably been one of my biggest challenges with endo emotionally.
Yeah.
It takes a toll on you and your mental health to not
Hmm.
be able to connect with your partner without.
Hmm.
So honestly, like as
I
far as
feel like
go
I
ahead.
feel like it can take like a toll on your partner too. Like they it can, yeah. I don't know. It's difficult. I feel like for them too, it can kind of be like, okay, why would I want to do that if you're in pain?
Yeah.
Like that's not what, like I love you. I don't want you to be in
Yeah.
pain. So,
Yeah.
and then you're over here like, no, I'm fine.
Yeah.
And you're like,
Yeah.
no.
So I think having a supportive partner obviously helps. I feel very like fortunate. My husband's
Yeah.
very understanding and has been with me through the whole endo journey. So
Yeah.
he has been with me through it all. Um, but honestly, I sometimes I just have to take you just have to take a step back from it and say like it's off the table for now. And we
Mhm.
can connect in other ways because I was getting to a point where every single experience was so painful that it was becoming like a negative
Yeah.
association where it was like,
Yeah.
this is bad, you know? So
Yeah.
that's
There's
not.
only like so much you can tell
Mhm.
your like at some point your body starts remembering that that's painful,
Yes,
even though
yes,
your mind is like, no, it's fine. Like I love that, like it, whatever.
yes,
So at some point, like your body just takes over what your
yes.
mind is
That's
telling
where
you.
I was
So
getting to. It was like the point where my body was having a
mhm.
full, like, we're not doing this. I'm
Yeah.
crying right now. Like, it
Yeah.
was bad. So I I feel like I've gone off topic from the physical therapy question.
No,
Sorry,
you're
but
fine.
I've done a lot of therapy, like talk therapy, to work through
Hmm.
this, and something called EMDR therapy. If you've ever heard of that,
No, ENBR.
it's called eye movement desensitization reprogramming (EMDR),
Oh,
and
okay.
it basically helps you work through and reprocess like traumatic and
Hmm.
memories or
Hmm.
events. Not to say that that's like traumatic, but we don't think of that as typically traumatic, but
Yeah.
to your body, it does feel that way.
Hmm.
So that's helped a lot. Talk therapy's helped a lot. And then honestly, just embracing the emotions. So going back to physical therapy, this is something that I don't know how many people have experienced this. I've never heard anyone talk about it, but
Hmm.
my therapist has told me that she's had other clients experience this. I will sometimes get in physical therapy if we're working on a really tight muscle in there
Hmm.
and it's just so stubborn, not wanting to let go. Sometimes it's almost like my body just takes over and it's like this release of emotion comes up and I feel
Hmm.
like, oh my God, like, why do I feel like I want to cry right now?
Hmm.
And at first I used to suppress it, but eventually my physical therapist could tell and she's like, you need to let it out because
Yeah.
you're standing in your own way. So literally, this is going to sound like the craziest thing ever, but I almost every single session, there's a point where I'm literally bawling. I start bawling
Uh-huh.
and crying. And then all of a sudden, that muscle that didn't want to let go and was so painful just completely lets go and it goes to normal. And it's like my body, I feel like, is just holding on to all this tension and trauma of endo and all the pain that it's caused. And physical therapy helps me let it go physically, but also like emotionally get it out.
Yeah. No,
So,
I've actually heard of that before. Maybe yeah, I've heard I don't know like if there's factual evidence to that. Like, okay, I have a master's in science, like I'm very like research orientated, but at the same time, like there's a point in that where like just because there's not like actual research on it doesn't mean that it's not real. We just haven't done the
yeah,
research
yeah.
to like who knows. But I have heard people say that like trauma
Mhm,
stays like in your pelvic floor or something like that,
mhm,
which is interesting. And I have heard of other people when they're in like physical therapy or stuff like that, or even when they're having like sex, they have like an emotional reaction and they're like, it's not from the person. Like, I'm not crying because like, I don't know. I just started crying.
yeah.
Um,
I definitely had that, and I'm
which is
glad you.
interesting.
That's what my PT always said. She's like, trauma lives in the tissues. So your body holds on to all these experiences you've had, and eventually, if you don't let it go in a
Yeah.
productive way, your body's going to let it go. So
Yeah.
it's very interesting. It's like fascinating to me. I wish there was
Hmm.
on it because it's like so intriguing.
Yeah. If I can, I'll look after this. If I can find anything, I'll link it in the show notes. But
Yeah. for sure.
Who knows? Like we said earlier, for some reason, um, they don't put funding into a lot of things.
I
So
think it's stuff
we'll
like
see if I
that.
can find something.
I feel
But
like it's more like the mind body connection. I feel like there's
mhm.
like nothing on that.
Yeah, I know. Interesting.
Yeah.
Okay, so
I'm very like candid with all my endo experience. So
yeah.
not there's no TMI to me. So
Okay, beautiful. I know. I feel pretty similarly. Like there's pretty much no TMI for me on endo. Like probably to a fault. I talk about it like all the time.
are probably sick of hearing me yap
I
about
know. I know, like my coworkers too. I talk about it all the time. And now I have like a podcast that we talk mostly about endo. And
Yeah.
my poor coworkers, I'm like, go listen to my podcast. And they're like, oh, I just heard about how much you're bleeding. I'm like, I'm sorry.
Yeah.
Ah, so I know you touched on a little bit when you got diagnosed, how you kind of felt like this like bittersweet, like it feels good and to know that you have it, but then it's also a lot to take in because it's chronic. So how has that kind of like evolved since you got diagnosed?
Um, honestly, it is kind of an everyday battle, I feel like, I feel like there's a really interesting kind of grief that comes along with having a chronic illness and
Hmm.
just because I find myself mourning the loss of like the life that I had before I had endo so much, so often, and just thinking like, how did I get here? Like,
Yeah.
what happened to, I used to be healthy, fine, like no issues, and now I'm like, I can't even go to work some days. I can't
Hmm.
even go to the grocery store. Like, it's just, it's such a mind, like,
I know.
I can't even. So it's been hard. I do a lot of journaling
Hmm.
with acceptance of this is, maybe not what I wanted for my life, but it's what it is. So trying to just come to terms with that. Um, but it's hard. It's really hard,
Yeah.
especially I am very like a control freak. So to have something where I have no control over when my endo
Yeah.
wants to take over. It's been hard to let that go, but the more time goes on, the more that I'm coming to accept it, but it really can take a toll on your mental health. I mean, I'm sure this is not uncommon with endo
No. Hmm.
experience depression, anxiety, stuff like that. So, especially with my next surgery coming up, it's been really hard for me to come to terms with that endo. It's come back so soon.
Yeah. Yeah.
It's
That makes
difficult.
a lot of sense. I feel like there's so much that goes into like the mental health and not feeling like you have control over your body. Like I
Mhm.
I feel like I've talked about this before in an episode, but basically like through grad school, so I graduated last year,
Mhm.
but for like the 2 years of grad school, I just didn't have the mental capacity to like deal with my endo. So I literally just didn't for two
Yeah.
years. Um, and I felt like very burnt out on everything else, and I like couldn't get myself to go to the doctors or do anything like that. So I was like, okay, I'm just not gonna have endo anymore.
Yeah. Yeah. No, I
Which
feel that.
I mean, obviously didn't do anything other than like maybe I had more honest, I don't even know if I had more flare-ups or not. Like, I did have a lot, but yeah, I don't. So
I feel like
it there's go
doesn't
ahead.
sorry,
You're good.
understand how mentally taxing it is to have to constantly be thinking about your chronic illness.
No,
Just
literally.
you can't put it on the back burner. It doesn't let you. So it's really
No.
important, like you said, to balance like work and school and everything else on top of it.
Hmm.
But sorry, go ahead.
Yeah. No, it definitely like it's hard to put it on the back burner and then it feels like even if you do for like a little bit, it's like it comes back double. And it's
For the
like, oh,
mention.
oh, you thought you could ignore
Yeah.
me? Frick you. I'm gonna come back and it's gonna be
No,
worse.
yeah. Yeah.
Um, So it gets really exhausting because I get like frustrated. So like on Sundays, I have this routine of where I go to the grocery store, I get all of our groceries for the week. We're doing like kind of anti-inflammatory. Like I'm also trying to lose weight, which is like a fucking nightmare when you have endometriosis or PCOS or like any type of inflammatory because my body doesn't want to allow me to do that either.
Yeah.
Um, so anyways, on Sundays I like go to the grocery store, I do all this meal prep. I'm very much type A, so I'm like, these are the things I can control in my life, so I will control that. And then I like meal prep some things, and there we've been doing a lot of traveling recently, and I haven't really been able to do that. And then we're like eating out a little bit more, and I'm like, is this I've been getting some flare-ups, and I'm like, why can I not just like have a chill week? If you're anything like me, then when you have a flare, you have nausea central and usually dizziness on top of that. But nausea is, oh my gosh, there is one thing that I seriously cannot handle, and it's feeling like I'm going to throw up. What I normally do in my nausea flare ups is I use the Hugs cold caps. They're super easy to use. You just pop one in the freezer, and when, like a headache or a migraine or nausea hits, you have a ready to go solution that fits comfortably on your head, wrapping you in soothing cold relief. For those with chronic conditions or sensitivities, having a reliable, natural way to manage symptoms can make a world of difference. And Hugs cold caps are just that simple, effective relief without the need of medication. If you want to give Hugs a try, you can visit wearehugs.com. That's wearehuggs.com and use Chronic Pod for a discount.
I know.
Because for 1 week, I didn't do all of the things that I do. And my body is like, oh, you thought you could do
Yeah.
that? No, you
No,
can't.
it's exhausting.
Yeah.
And on top of it, first off, it's exhausting to just do all that you just listed. Like to
Yeah.
grocery shop, meal prep, constantly be thinking like, what am I eating that's gonna cause a flare up? Like, it's
Hmm.
exhausting. And sometimes I've had people say to me like, oh, maybe you're just like trying too hard, or maybe you just need to relax a little bit. But it doesn't work that way because
No.
it just doesn't work that way. Because if I just did whatever I wanted and ate out every day, like I would literally be crippled. Like there's no way
Yeah.
to be able to function at all.
Yeah. Like it will come back to bite me.
Try and manage it, and then to still keep up with the expectations and responsibilities of life.
Hmm. I know. It's truly exhausting. Like I really do say to people, like to my mom or to I have four little brothers. To them, I'm always like, listen, like it's essentially another full-time job because I that I like can never clock out of, by the way, because it's always on my mind. Like even when I'm working my full-time job, I'm like, okay, how much caffeine did I have today? Because I know if I have another, like I'm exhausted because that's a symptom of endo is just like chronic fatigue that I have heavily. So I'm like, I'm exhausted. I've already had 2 cups of coffee. Can I have another one or is that going to cause a flare up because that's too much caffeine?
Mm-hmm.
Can I put more, like I want another latte, but can I have more milk or is that gonna be an issue? Like it's so many things that like my brain just like never stops working.
Yeah, I feel like that's another thing that I've been kind of learning to balance a little more. Is I used
Hmm.
to be very stressed and rigid about what I was eating, what I
Hmm.
was how I was exercising, like every single thing. I was like, what's in this food? Is this going to cause a flare? Like I would get so almost obsessive about
Yeah.
everything. And it just got to a point where I'm like, this is not healthy. Like the stress of all of this is probably worse than just like eating a cookie. So like
Yeah.
I I've kind of learned to relax a little bit about it because
Hmm.
I always joke with my husband. I'm like, okay, well, I can either be in pain and not eat this chocolate chip cookie, or I can be in pain and eat the cookie. So I'm gonna
Yeah.
just relax a little bit and live life. Obviously, still trying to be
Hmm.
anti-inflammatory as much as I can, but trying to really find that like 80-20 balance
Yeah.
because
Yeah.
there's no point in driving yourself nuts.
I know. I just feel like I've had so many flare-ups recently. Granted, I need another surgery and I've been pushing it off as much as I can. But I've been having a lot of really bad flare-ups recently, and I've it's been difficult because I've been trying to lose weight. So I've been doing like these exercising routines, and I have been trying to get into running. I'm like, oh, I want to be a runner. Like I'm gonna try to get into it. My body just does not agree with running. Like I can run and I feel fine like during it, but then probably 20 minutes after, I am bloated
Mm-hmm.
crazy. Like I that and it's not even like I'm not having cramping. I just look 4 months pregnant like 30 minutes after running and I'm like, what the fuck is going
Worse.
on?
Yeah.
Yeah. So I see a naturopathic doctor and I like brought that up to her. I'm like, what is going on? Like I feel fine, relatively fine during the run. And then like 30 minutes after, I have endo belly. Like why is this happening? And she's like, well, you could be like you running and pushing yourself, it could be like tugging on some adhesions and you're like essentially causing a flare up. And I'm like, okay, well, I didn't know that could
Yeah.
happen.
Yeah.
And she's like, yeah, I think you should probably stick to like walking, low impact, stuff like that. And I'm like, oh, okay. So now endo is making it so I can't even run.
No,
Cool.
literally, it's so frustrating to just feel like there's I don't even know how to explain it. It's like endo, it chips away at all these little things in your life. Like you can't do this,
Hmm.
you can't do this anymore. Till eventually you're like, God, it's like sucking the life out of everything.
I know.
That same thing. I used to be very active before I had my endo come up. I would exercise all the time. I was in dance 6 days a week, or I was in
Hmm.
martial arts, like very active. In college, I would lift weights every day. But now I haven't been able to exercise consistently in years just because every
Yeah.
time I try to go, it's like debilitated flare up afterwards.
Yeah.
So it is hard.
I know. It gets really, really frustrating. And I don't know, like I just I'm trying to now at this point in my life, I'm trying to like isolate things that cause flare-ups.
Mhm.
So like I only did running for like I didn't do really any other exercising other than running for like a month. And I'm like, okay, yeah, every single time I run, I'm getting bloating. So now I'm trying to do like essentially like YouTube format Pilates and seeing like if that is fine. Because my I'm like, what are low impact exercises? Like, I guess I don't know. And she's like, okay, well, you can do like these things, see if
Yeah.
these work. And I feel like the low impact, like I literally just go on YouTube and I look up like low impact Pilates floor. That has been fine. But
Yeah.
the second you start to, for me at least, the second I start to do like sometimes I watch a video and like that's what I search, but it's a little bit more of like a hit workout, like
Yeah.
it's faster. The
Yeah.
second I start to do that, I get a flare up. And I'm
Yeah.
like, okay, so anything that is like
Fast.
fast,
Yeah.
fast movements are not good for my body.
Yeah.
So, and not everybody with endo, gets that. So
It's
I
so
don't,
individual.
yeah, everything is just so, I feel like that is also another reason that I don't blame healthcare providers because I'm like, every single case is so different. And it
Yeah.
like, I feel like it very much depends on where your endo lesions and adhesions are
Yeah.
into like what symptoms you have. So, how can we blame them when like every single woman that comes in is just so different?
Yep. It's very hard. Even like I've seen a lot of, on social media, a lot of more holistic providers will talk about like stuff to do for endometriosis. And I'm a good example. Like you can do all of those things and
Hmm.
it still might not work. It just depends on you individually, like what exactly is going on in your body.
Yeah.
And that's what's so hard is trying to figure out what does your body specifically need. And I feel like that's where our healthcare system is not really conducive to that right now. I
Yeah.
mean, you go and see a doctor, you're in there for like 15 minutes, if
Hmm.
that, and then next one, like there's
Hmm.
just, you don't have, unfortunately, the time to get to the
Hmm.
root of the issues.
I know. I feel like for this type of stuff, like chronic health,
Mhm.
it's different. So I worked in like a family care practice for a summer. and I was a medical assistant there. Outside of that, I worked in dialysis for 4 years. So like that's like a different thing. But like in the family care setting, it is that. Like you
In and
the
out.
time that the patient is with the doctor is literally 10 to 15 minutes. And then everything else is with either a medical assistant or a nurse for like intake stuff.
Yeah.
And then I that's one thing when you come in for like maybe a yearly checkup. I don't know if there's really any time where it's appropriate to only have like 15 minutes, but like maybe for
Yeah.
like a routine checkup where you don't have anything wrong with you,
Yeah.
like you just don't.
Yeah.
But when you have chronic, like in a family, I don't know if people realize this, but like when you go to your family doctor, a lot of times that is where you go for like chronic health
Yeah.
support is
Mhm.
going to like a primary care physician or a family doctor. So even with endometriosis, you can go see a gynecologist for your appointments, but most of the time you do go to your family practitioner and
Yeah.
that's where you get like your routine care.
Mhm.
Same thing with like diabetes. I can't think of other chronic like Graves' disease, thyroid issues, all that stuff. Like you go see your primary care practitioner and they treat everything, right? Like they're not specialized in those things. So then when you go see them and you have them for 10 to 15 minutes and they've seen 25 patients that day,
Yeah.
yeah, like there's only so much that they're like,
Them about
they're,
endometriosis that's like out of their scope.
yeah, like they are not specialized in all of these things. They're specialized to like treat
General healthy people.
general things. So I really full-heartedly believe that like chronic conditions, you need like an hour with
Oh
your
yeah.
provider for your
Yeah.
appointments to actually talk about things that matter.
Yeah.
So I don't know.
It is hard. It's frustrating. I know. I get nervous thinking about like when I'm a nurse practitioner, I'm like, oh God, I don't want to be doing those like 5 minute appointments with people. Like,
I know it
yeah.
gets really hard. That I know. I feel like you and I need to have a combo outside of this because we can talk about some of that stuff too. But before we start to wrap up here, I did want to ask you one or two more questions, one of them being about advocacy. So I know that on first of all, what's your Instagram page?
Cyclical wellness.
Okay,
So,
perfect. So I'll also link that in the show notes for people that want to go follow you and
oh
keep up
yeah,
with you. But you do quite a bit of advocacy on your Instagram page as well. Do you have a TikTok or anything like that? Or is
I
it just
did, but then I
Instagram?
got rid of it because people on TikTok are kind of vicious.
That's valid. They kind of
I
are.
was like, oh God, they do not like holistic health here.
Yeah. That's okay. So on your Instagram, I feel like you do a lot of posts and like educational advocacy things. Is there anything that you want to say kind of just about like advocacy and how you feel about that? Like, is that an
Yeah.
important aspect
So
to you?
I like to use my Instagram page as kind of well, a lot for education. I like to educate on stuff I'm learning about different
Hmm.
holistic ways to manage women's health issues, but also to share like my journey with endo and to spread awareness about it because
Yeah.
I mean, I'm sure we can all agree it's definitely becoming more popular now to talk about endometriosis openly,
Hmm.
but it wasn't always that way.
Right.
And I feel like still women's health issues can have sort of like a taboo around them. So I just feel like the more we talk about it and the more open we are, the better things will be for us who have it. So that's
Yeah.
really what I like to do with my page is to show sort of the unfiltered reality of endo. So I like to spread education about it, but also to show like this is my reality with it. So
Yeah.
I don't know. I think it's a fun way, not fun, but a good way to teach people about it and to just raise awareness.
Yeah. I think that I 100% agree with you. And I mean, advocacy is so important for so many things. And I feel like one of my main reasons is the more we talk about it, the more people will learn about it, the more people will want to put funding into research, and the closer we'll be to like actually having a non-invasive diagnostic, which is so important. Um, because right now, like the statistics on how many people have endometriosis, how long it takes, there's probably a lot more than 1 in 10, just based off of like, I can imagine that like there are some people that don't get surgery. Like they just opt to not do that.
Yeah.
So I feel like that would be really cool if we could ever get to a point where, I don't
Yeah.
know, we can do some type of diagnosis outside of surgery.
I think also the more that you talk about it too, the more I found support, and
Yeah.
not just with other people that have endo, but from just people in my life, like friends, coworkers, family. The more open I am about my experience, the more I've found like, oh, people actually care like about
Hmm.
how I'm doing, and it makes you feel less alone too.
Yeah. Yeah, for sure. All right. We're getting close to the end here. Is there anything else that you want to say?
Um, I don't know. So I mean, if I think one of the biggest things I've learned having endo
Hmm.
is just you have to be your own advocate. You
Hmm.
can't just take no for an answer. Sometimes you can't listen to what the first doctor, the second doctor, or even the third doctor says. If you think there's something
Yeah.
wrong, then you deserve to work with a provider that believes you and that actually wants to help you get to the root and get you better. That's the only thing I'll say.
Yeah.
Just take for yourself and don't stop.
I couldn't have said it better myself. That's great. Thank you so, so much for coming on the podcast. I think that everyone's gonna love this episode.
So much for having me.
Yay! That wraps up another episode of the Chronic Chronicles. Thank you so, so much for listening to today's episode, and I really hope that you found some solidarity in today's episode. And, if you are experiencing endo symptoms and maybe you don't know what is causing your pain, I hope that you got some good information from this episode. And if you did, or if you didn't, please feel free to leave me a rating and a review. My goal is to get 25 reviews, like actual word reviews, on either Apple or Spotify by the end of 2025. So if you want to help me out with my goal, please go leave a review. I'm open to any feedback. And as always, my Instagram direct messages are always open. You can always reach out to me with literally any feedback, questions, anything, and I'll try my best to, give you whatever tips I have. So you can follow us on Instagram at Chronic Chronicles Pod. And thank you again so much for listening. I will talk to you next week.